Thursdays. We've now had about 60 COVID deaths in 10 days in New South Wales with a full lockdown on and increasing rates of vaccination. I asked the New South Wales Premier if we can expect more or less deaths once things open up with a higher vax rate, and she didn't really answer. Are you expecting more or less deaths, a higher or lower death rate when you open up at 70 and 80% double vax?
Well, obviously, the biggest protection against being in hospital and against dying is getting vaccinated. And the more protection our community has, the higher rates of vaccination we have, obviously the lower number of deaths. And obviously last year, without the vaccine, when Victoria had their outbreak, they lost hundreds and hundreds of people. And we haven't seen that yet in New South Wales because of the vaccine.
But just on that, you said to me a few weeks ago that 80% double dose is 63% of the total population. Do you have any sort of modelling on the potential number of deaths a week in New South Wales?
Certainly none that I've seen. But I say this: the biggest protection for us is for people to follow the health orders and to get vaccinated.
Kerry Champ making clear that what can be opened at 70 and 80% double vax will depend on the case trajectory as well, and we can only hope that case rate is flattening out now.
We consider a range of factors. We consider the case trajectory, we consider vaccination coverage, we consider who's been vaccinated. Is that equitably distributed in the population? Have the vulnerable people in our population be vaccinated? So we consider a multiple of factors in giving our advice.
Each day when Kerry Champ mentions the deaths, she talks about a number of people having underlying health conditions. This jars a bit, so I asked Dr Champ what sort of conditions she was talking about. Can you tell us what some of those are? Is it diabetes, heart disease? Is it something like asthma even that are underlying health conditions when you mention these deaths?
There's a range of underlying health conditions. So people might have cancers that make them immunosuppressed. They might be on immunosuppressive treatment. They might have existing lung disease. If they've got chronic obstructive lung disease, emphysema, those sort of diseases. Diabetes puts you at increased risk. Obesity puts you at significant obesity puts you at risk. Is that an underlying health condition? When you say someone's died and they're obese, is that No, we're not counting obesity.
Because that's my question, sorry. Could asthma be included, for example?
I am not saying that none of our cases have had asthma, but when I've been reading through the details of the underlying health conditions, just of the ones that have died most recently, there've been significant underlying health conditions, often multiple comorbidities. But I think rather than dwelling on that, because I just want to convey that vaccines work even with people with underlying comorbidities.
Deputy Premier John Barilaro told regional media yesterday the curfew on Western South-Western Sydney was put on as a result of media pressure. Well, the federal member for Reid, which is affected by the curfew, Fiona Martin, responded to this by tweet today. The Liberal MP saying curfews need to stop. The evidence is mixed and they are not proving effective. 4 out of 6 local government areas in Reid have very harsh restrictions and it's impacting people's mental health. Barilaro backed away from those comments today, and Gladys Berejiklian herself said that it was hard to see what had worked and what hadn't, but case numbers would be a lot higher without restrictions. Really saying it was only media pressure that caused the curfew decision?
Well, you've just heard what Dr Chan has said. There's no question that police and health advise the government in relation to curfews.
Well, that's not what you said yesterday, is it?
What I said was, firstly, I was asked about a question in relation to Dubbo, would I impose a curfew on Dubbo, and I said no, I would not. And the reason I would not is if you look at Victoria, they've had a curfew from day one, and what has it done to their rate? Their rate's accelerating, and we're seeing their numbers continue like that. But in Western Sydney and South-Western Sydney, we're at a point of crisis. There was no question that we had escalating numbers, and therefore we looked at other tools and measures in relation to dampening or suppressing what was occurring. And therefore, on the advice of police and on the advice of health, the government made a decision about curfews.